and welcome to another episode of Cardiometabolic Beat, brought to you by the Cardiometabolic Health Congress. Today, we have the pleasure of speaking with Dr. Irl Hirsch, Professor of Medicine and Diabetes Treatment and Teaching Chair at the University of Washington Medical Center in Seattle, Washington. At the upcoming 2021 CMHC Annual, Dr. Hirsch will be presenting on an intriguing topic, that of new-onset diabetes due to COVID-19, which will also be our topic of conversation today. Dr. Hirsch, thank you so much for joining us.
Thank you for having me.
As we speak, we are now in the midst of another wave of the COVID-19 pandemic, and as well as you know, the impacts have been significant. Early on, there were initial reports about new-onset diabetes due to COVID-19. Almost 2 years into the pandemic, what do we know about the association of COVID-19 and diabetes and about new-onset diabetes caused by COVID-19?
It's a great question, and we're still working it out. I think we need to separate this into type 2 and type 1 diabetes because the answers are a bit different. For type 2 diabetes, most but not all of the data suggest that there is something very real going on, perhaps due to the effect that this ACE2 receptor, which is how the COVID-19 virus enters the cell. As it turns out, this receptor is also expressed on the beta cells. And it may very well be that after a COVID infection, that there is destruction of these beta cells in the pancreas, which causes an insulin deficiency, which results in new onset diabetes. Now, having said that, it's much more complicated than that, because during the actual infection for people, especially in the hospital who are very sick going through the cytokine storm, those cytokines make people extremely insulin resistant. So in the hospital, you potentially have a beta cell lesion, you have an insulin resistance lesion, and in fact, we see people who come in, normal hemoglobin A1Cs, get very sick, get very hyperglycemic, require 10, 20, 30 units of insulin IV an hour, and that's without dexamethasone. They get taken off their pressors, they get their intubation is successful, they get taken off the ventilator, and they go home, and after receiving 10, 20, or 30 units of insulin an hour, they go home on no insulin at all, and they don't even have diabetes. And so this is obviously complicated. There is a registry, an international registry that will be looking at this, but we're still learning as we go. Type 1 diabetes is also interesting. At first, there appeared to be more new onset type 1 diabetes, especially in children. But now the way the data is looking, especially from registry data, is that it looks like what we are really seeing is no change in the appearance of new onset type 1 diabetes, but more severe presentations with more severe DKA, because patients, and in the case of children, their parents, are bringing them in much later because they've wanted to avoid bringing their children into the hospital. So the DKA is more severe, but at least as of now, it doesn't appear there is more diabetes. But again, this is we're learning as we go, and this could all change.
What patient profiles are more common in this setting? Are these cases in patients with prediabetes, for example, or are they more type 1 or type 2 cases? Or are they something else entirely different?
Yeah, the patients who come in who are already obese with or without diabetes or prediabetes, those are the ones we struggle with the most, at least up until now. And as far as the glucose levels are concerned, where we really struggle is when we have to use the dexamethasone. But I think we're still learning as we go, but I do think there is something going on in the beta cell itself. With all of these populations, it's just too early to really understand it all.
And to add on, how do we know whether COVID-19 is actually the cause of new diabetes?
Well, if we're talking about type 2, we know it is in those people who come in with normal A1Cs and they leave the hospital and they need medication for their diabetes. That's clearly new. But you're right. A lot of these people come in and they have undiagnosed diabetes, or maybe they have prediabetes, and this is what puts them over the edge. I should also point out, anytime somebody is critically ill, things can go wrong with the glucose metabolism, and sometimes it takes a while for the dust to settle. And the biggest concern, of course, is really understanding if they have diabetes or not, if they are on steroids, especially when they leave the hospital.
Does hyperglycemia caused by COVID-19 usually resolve within a certain time frame post-infection, or is it persisting?
Depends on the patient. And some people, they seem to have permanent diabetes. It appears to be a non-autoimmune, more like type 2 diabetes, but there does seem to be a very specific beta cell lesion that still needs to be better identified.
And final question, from your practical viewpoint, what are some take-home messages that you would like to share with your colleagues about the clinician implications of these associations? And what should we keep an eye on as the COVID-19 pandemic continues to evolve?
Well, we know with or without COVID, we underdiagnose diabetes. There are so many people with diabetes and even more people with prediabetes. It just so happens that if one does have a diagnosis of COVID, that they have an increased risk of developing diabetes. And I think the main issue for clinicians is to always be suspicious and looking for diabetes with either glucose screening or hemoglobin A1C screening. Because if somebody really does have diabetes, they deserve to be treated no matter what that treatment is. The patient needs to know as a way to reduce the hyperglycemic burden over time.
Well, thank you so much, Dr. Hirsch, for your time and expertise.
You're very welcome.
And thanks to all of you for listening. If you have any questions or if you have any feedback on topics you would like us to discuss on future episodes, we would love to hear from you. You can email us at info@cardiometabolichealth.org. Thank you, and until next time.